From the PEP Radio Newsroom, this is the latest news blast. LGBTQ Nation is reporting gay Michigan Attorney General Dana Nessel has issued a warning to the University of Michigan after the school's medical center announced Monday it will no longer provide gender-affirming care to patients under 19 due to threats from the federal government. The announcement from the University of Michigan that they will no longer provide their transgender patients with all of the health care options available is shameful, dangerous, and potentially illegal, Nessel said in a statement. This cowardly acquiescence to political pressure from this president and his administration is not what patients have come to expect from an institution that has labeled itself the leaders and the best, and my department will be considering all of our options if they violate Michigan law. State anti-discrimination law bans discrimination on the basis of gender identity. Nessel told healthcare providers that the availability of federal funding has no bearing on Michiganders' right to seek and receive healthcare services without discrimination. Moreover, access to federal funds does not relieve Michigan healthcare facilities and providers of the obligation to comply with Michigan laws, she added. An email to staff at the school's medical center, Michigan Medicine, called the decision to halt gender-affirming care for minors difficult and complex, Advocate reported. It was made, the note said, in response to unprecedented legal and regulatory threats against our institution and our employees, including threats of criminal and civil charges against our prescribing clinicians. Please know that we are committed to working with our patients, clients, to ensure appropriate individualized care plans, it continued. We will offer to meet individually with impacted patients and clients to explore options for ongoing care. We understand how impactful this change is. If you are uncertain about how this change might impact you or your clients and patients, please discuss this with your supervisor. At least 21 hospitals and health systems have suspended or reduced health services for transgender minors and young adults in 2025, according to an NBC News analysis. Many providers cited fears of federal investigation and the potential loss of government funding. In January, the president signed an executive order directing federal agencies to cut off funding for gender-affirming care for minors and instructing the Department of Justice to investigate and criminalize providers and health care centers that offer such care. In April, Attorney General Pam Bondi ordered the DOJ to investigate providers, hospitals, and clinics that provide gender-affirming care to trans youth. The crackdown escalated earlier this summer when federal prosecutors issued subpoenas to more than 20 hospitals and clinics. In August, 16 states and the District of Columbia filed suit in an attempt to block the administration's investigations. However, several providers that received subpoenas chose to suspend offering gender-affirming care instead of waiting for the outcome of the lawsuit. According to the NBC News Review, 12 hospitals have either stopped or announced plans to stop prescribing puberty blockers or hormone therapy to patients under 19. 4 hospitals have ended gender-affirming surgeries for minors, and 1 facility halted all gender-affirming care for trans youth under 18. At least 6 other university-affiliated health systems, including Stanford Medicine, the University of Pittsburgh Medical Center, or UPMC, University of Chicago, University of Pennsylvania, Rush University Medical Center, and Yale New Haven Hospital have ceased offering some or all trans-related health services. That's the news at this hour. If you are watching the video version of our news content on YouTube, please subscribe to our channel. The PEP Radio program schedule for fall 2025 is now available on all our social media pages. Up next, we have the Meadville area weather forecast here on PEP Radio.